Okay, so at this point, I have already done all my med checks. I've made sure the dose was safe for the patient, and I've gathered all my supplies. So now we're ready to go into the patient's room, and we're here. So first, I'm going to perform hand hygiene, and then I'm going to introduce myself to the patient. So, hi, Mrs. Jenkins. My name is Kaylee. I'm going to be your nurse for today, and today we're just going to be administering some medication to you. Can I get your name and date of birth?
Yeah, my name is Mr. Jenkins, and my date of birth is January 7th, 1947.
Awesome. So then we're just going to double check that with the medical record, or Ms. Jenkins' electronic medical record, which, yep, matches. Okay, so like I said, we're going to be administering you some meds, specifically one called Coumadin, which is an anticoagulant. But before we do any of that, could you rate your pain for me on a scale of 1 to 10?
I would say I'm about a 4 right now.
Okay, awesome. Have you had any like nausea, diarrhea, vomiting, or anything going on like that?
No, I'm just experiencing mild pain.
Okay, awesome. So now that we've done all that, we're gonna go ahead and explain the medication to you. So yeah, so like I said, Coumadin is an anticoagulant, which means that it's going to interfere with our body's clotting factors by inhibiting the synthesis of vitamin K, which will prevent clots and all that good stuff for you. We're giving this to you because of your past medical history of atrial fibrillation, which is just an abnormal or irregular heart rhythm. Hypertension is listed on there for you, type 2 diabetes, and because most importantly, you just had a recent hip surgery. So we're really just giving this to you to prevent blood clots and keep you going and keep you feeling good. All right. So, but we also want to warn you about some dietary implications here. So we definitely don't want to be taking aspirin with Coumadin. It can just cause a load of problems because aspirin tends to cause some bleeding and everything, and we don't want that to mix with the Coumadin. So avoid aspirin, and then if you really enjoy your leafy greens, just beware that our leafy greens are high in vitamin K, which can actually kind of decrease the rate at how the Coumadin works and just kind of cause some problems there, but just be aware of that. Nothing big. So now that we've explained the medication, why she's taking it, we also want to let you know about some side effects. So it can cause hematuria, which is just some blood and urine. You'll just notice some red or anything in your urine. It also can cause hematemesis, which is when you vomit blood. So just be aware of that. Black and tarry stools, so you'll just be looking for like stools that are black or have red or any kind of abnormal stool color going on there. Just let us know about that. And then just beware of also like petechiae or ecchymosis. Ecchymosis is going to look like a bruise or any of that, so just let us know if any of that pops up. Or petechiae, which is like little purple or red spots that pop up under your skin. It's just like bleeding under the skin. So just let us know if any of that happens. Once we've explained all that, we are ready to give the med. So we're gonna again do our 3 checks. So I'm gonna pull the medication out of the drawer, and then we're gonna read it and then just match it to the order in the record. So we have Coumadin 2.5 milligrams, PO at 1800. So then, yep, Jenkins, Coumadin 2.5 milligrams by mouth, 1800. And then we're gonna check again when we pull it out and put it in the cup. We have Coumadin 2.5 milligrams, PO, Coumadin 2.5 milligrams, PO. And then the next time that we check, it's gonna be actually at the bedside, which we are at now. And we're just gonna be sure again to check Coumadin 2.5 milligrams, Coumadin 2.5 milligrams, and just making sure everything matches, patient, all that good stuff. So now that we're actually at the bedside and about to administer, we're gonna make sure that Ms. Jenkins doesn't have any difficulty swallowing or have any other issues with that. And if she has a preference, like whether she wants to take all of the medications at once or if she wants to take them individually. So how would you like to take your medications? Would you like to take them all at once or individually?
All at once is fine.
Awesome. So we'll have them all put together. And then, do you have any difficulty swallowing or any of that?
No, should be good.
Because the medicine is PO, we do want to elevate the head just a little bit to make sure everything goes down smoothly. So we have Mrs. Jenkins elevated just a little bit, and now we're all ready to give the med. So here's your medication. And we also have water here and ready for the patient, which will open just to help with swallowing. Okay. Okay, so now we want to check and see if Miss Jenkins had any difficulty swallowing or any problems with that. So did you have any difficulty swallowing or taking any of that down?
Mm-hmm.
Awesome. And then we also just want to make sure you took all of your meds. So can you open up for me? All right, great. All the meds were taken. So then at this point, I'm going to go to her, Miss Jenkins' medical record. I'm going to document that she took 2.5 milligrams of Coumadin at 1800 PO, all of that good stuff. So that's documented now. And then before we go, we just want to make sure that Miss Jenkins is left safely and comfortably. So we want to position Miss Jenkins however she's comfortable, or whatever the doctor's orders are. If there's a specific type of way she's supposed to be positioned, then we'll put her that way. But for now, just comfortable. And we want to make sure the bed is lowered, guardrails are up, and that the call light is within reach. So is there anything else I can do for you before I head out of here?
I think I'm good.
Okay, so if you need anything, we're going to have your call light right here, and just press it and we'll make sure that we get to you right away. And then just in general, we'll be rounding on Miss Jenkins in just a little bit, probably around 30-ish minutes, to make sure that there's no side effects of the medication showing up, or making sure she's feeling all right and taking it all good. And then we're also going to be taking her vitals and reviewing over her lab, which would include like an INR and a PTT. So I'm Kaylee Courtright, and this is my med administration video.